Raising a family is something a lot of people look forward to, but it's never guaranteed or as easy as it seems. Infertility sometimes stands in the way of many couples' dreams to sire children. When this happens, the blame is often shifted to the woman, despite the fact that men too suffer infertility.
And you find that, not surprisingly, that men are in denial. They don't accept it very easily. It's like you hit a man's ego to the highest, But a few do come forward and accept, the options which are available to rectify the situation.
In context to Kenya, we have done almost, we have seen more than 2,000 Kenyan men with, and almost more than one third of reason for infertility is because of the male factor. So the count is low, either the motility is low.
According to the World Health Organization, infertility is defined as the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. It is estimated that 48 million couples globally and 186 million individuals live with infertility. In Kenya, about 4.2 million people require medical assistance to be able to conceive. On average, the normal sperm count ranges from 15 million to greater than 200 million sperms per milliliter of semen. One is considered to have low sperm count if they have less than 15 million sperms per milliliter or less than 39 million sperms total per ejaculate. And the dynamics are now shifting with the ever-changing dietary needs as younger men increasingly suffer infertility.
So most of them are from 30 years to 60 years. I mean, even men at 60 comes here for parenthood. So there is an established fact that men after 45, the quality of sperm declines because of the DNA fragmentation of the sperm. That is age-related. But even those who are young, their sperm count are low or very low. The motility is bad, the morphology is bad, and most of them are obese.
According to the World Health Organization, low sperm count in men is often attributed to environmental and lifestyle habits such as smoking, excessive drinking, overexposure to toxic pollutants, obesity, or obstruction of the reproductive tract, infections causing dysfunction in the ejection of semen.
Like, it's been known that people are exposed to industrial chemicals, pesticides and the rest. They actually reduce sperm count. It's also been known that heavy metal exposure like lead, there are people work in those industries, that really affects sperm count, or exposure to radiations or X-rays. The other one which is interesting is the overheating of the testes. So that would affect about people who are doing border riding, Yeah, so you find studies have been done which have shown that anybody who exposes the testes to high temperature, that's border riding, long distance truck drivers, or if you just sit for long with tight clothing, it's been known that that environmental factor can actually reduce sperm count.
Furthermore, infertility could be attributed to genetics in various occurrences, as it could be transferable from father to son. On the other hand, there are now various treatments in place to address the issues at hand, such as treatment of infections in the reproductive tract, assisted reproductive technology, and hormonal treatments where infertility is brought about by increased hormonal levels. However, the lack of a legislative framework to address assisted reproduction is seen as a challenge for couples seeking fertility treatments. Helen Aura, NTV.